The slides aren't, let's see here.
That's brilliant, by the way, putting a slide in to remind them.
Yeah, it's like, I think. Sorry about that. 1 second here. I gotta stop sharing and reshare because it's not advancing my slides properly. All right, thanks for the delay. So applying critical reflection to reimagine global health. When we talk about reimagining, what we mean here is decolonizing global health. And what do I mean by decolonizing? I'm going to turn to Say Abimbola and Madhu Pai, who have been critical thinkers within the global health field, to really rethink and define what we mean by decolonizing. So to decolonize global health is to remove all forms of supremacy within all spaces of global health practice, within countries, between countries, and at the global level. Supremacy is not restricted to white supremacy or male domination. It concerns what happens not only between people from high-income countries and low and middle-income countries, but also what happens between groups, individuals within high-income countries and within low and middle-income countries. Supremacy is there, glaringly, in how global health organizations operate, who runs them, where they are located, who holds the purse strings, who sets the agenda, and whose views, histories, and knowledge are taken seriously. Supremacy is seen in persisting disregard for local and indigenous knowledge, pretense of knowledge, refusal to learn from places and people too often deemed inferior, and failure to see that there are many ways of being and doing. Will global health survive decolonization? Perhaps, but only if its practitioners commit to true transformation. So with that, I introduced the overall research question. How might critical reflection support global health practitioners in reimagining our interventions? So by critical reflection, I mean considering and analyzing past, present, and future experiences in order to reassess our thoughts, beliefs, feelings, and actions. Or it can also mean a type of reflection characterized by an individual's re-examination of the presuppositions that inform their own beliefs, thoughts, and actions. By global health practitioners, I mean people working within the field of global health that aims to strengthen healthcare systems within and across countries, particularly in low and middle income countries. By interventions, I mean these are the things that we implement, and there's a huge variety within the space of global health. They could be health programs, they could be clinical research, it could be distributing bed nets, it could be new policies at a national level for resource distribution, or new clinical guidelines to instruct care. And when I use the word "our," I mean that very intentionally, because I'm part of this community and have been for the past 10 years. And I currently work at the University of Washington in the Digital Initiatives Group, designing, implementing, and building digital health technologies. And then critically, what do we mean by reimagining? This term just means to think again about a problem or an issue, to revisit, to review, to reconceptualize. So why is reimagining important within global health? As we've discussed, there's a commitment to global health equity, yet our field is really steeped in power asymmetries where much of the funding, leadership, and evidence-based interventions originate in the global north. And there's a lot of evidence for this across our field. So looking at some data, global health is colonial by its design. Only 7% of global health organizations are headquartered in sub-Saharan Africa. Only 24% of global health organizations are headquartered in low and middle income countries, led by nationals. And most of the money for global health fills the pockets of organizations and nationals within the global health. And this is across research, this is across foundational funding for implementation. So really it goes to the global north first and then moves into the global health space. So what's the problem if the privileged dominate the global health or dominate global health? This slide comes from Professor Madhu's talk last week. Can we walk our talk on decolonizing global health? And recognizing that folks in the global north and those who are in privileged powers in low middle income countries lack the lived experience for most of the people that are served by these health interventions. Our privilege prevents us from seeing things clearly, we're far away from real problems, and we're far away from real solutions. We will make mistakes even if we have good intentions. We will center ourselves. We can stop feeling generous with no accountability, and we may fail to address the structural issues. So now looking at the roadmap for this talk and this dissertation in general. So at the end, I will begin life with a PhD, ideally. And right now we're going to go through what's going to kind of get us there. So first is the big idea, and I'll go through what that is in just a moment. Then I'll get into some of the preliminary work that I've done to kind of look at that idea and explore it. And then we're here to look at the proposed research, so the plan moving forward that I will actually do and do the research and then write a dissertation. So today's conversation is really a defense of this proposal. So this is a public Q&A to improve the proposed research. And for all of you in person and all of you online, I really invite you to come up with questions as you go. I'm excited to get critical feedback. I'm excited for ideas to really grow this idea. So all questions are welcome. And then I'll do a closed session with the committee to go into many more details about this proposal. And then eventually, after I do the research, there'll be this dissertation in defense. And so this is your early invitation for that event. So let's jump into it, the big idea. So we're going to go into the motivation and the evolution of this idea. Really, this was inspired by me, a public health practitioner coming into human-centered design and engineering, where I took brand new coursework across fields that I'd never been exposed to. So I was exposed to many new ideas and ways of knowing, and ideas from new fields like critical technology, feminist theory, science and technology studies, and then new readings within global health as well. And I'll just say massive thanks to HCDE, my cohort, because it really was like a massive explosion of ideas within the first 2 years of my coursework. So let's talk about some of the influential theories. There's really two that I want to highlight here that might be new to the global health space. The first is this idea from Langdon Winter about, do artifacts have politics? And by artifacts, we mean interventions. And the idea that he proposed is that these technological artifacts are not neutral. Instead, these interventions are embedded and reflect social and economic systems. And Winter gives many examples of political designs, and especially this idea of these roads in Long Island that controlled who could access beaches. So they were actually designed to be too low so that car traffic could fit through, but not buses. So it really limited the access to the beach. So the idea that I want you to take away from this idea of, do artifacts have politics, is intervention designers have responsibility to examine the context and values that influence their intervention designs. So moving on to a second influential theory, and that's Donna Haraway's situated knowledge. The idea here is that our knowledge is shaped by our perspective. So here you have a little baby, and as you grow, you get more and more perspective. But we have to recognize that our perspective is limited. Our bodies and time limit our ability to experience the world from various angles. And what Donna Haraway proposes is this God trick of omnipresence is impossible. So every individual has and should recognize the boundaries of their own knowledge. There's so much knowledge out there. And adding to this idea of situated knowledge comes in Patricia Hill Collins's work on the matrix of domination. And her empowering quote is, no one group has a clear angle of vision. No one group possesses the absolute truth. So the takeaway for this is that the opportunities for reflection can really help us recognize and explore our situated knowledge, and really looking across the field of global health, just recognizing that there is a variety of untapped knowledge potential and things that have yet to be uncovered and brought into practice. So moving on from this PhD coursework and a lot of different theories and readings, I moved into Beth Kolko's feminist theory class. And this was a combination of a feminist theory quarter and critical technology. So I read a ton of papers within 3 months. And I ended the feminist theory course writing my first paper around Towards First Commitments, a draft guide for personal reflection in health technology design and evaluation. And what came of that was really a catalog of question prompts that I intended to use for my own personal practice. So just to give you some examples of the prompts that I collected, there are just tons and tons of them from different scholars across different fields. So ideas like, am I thinking about this community as a blank slate, or have I acknowledged and learned about the deep and long history? Or another example, how do we acknowledge the labor required to build trust? So I took that catalog of questions and just sort of sat on it and used it occasionally. And then came my general exam where I read a ton more across many different fields. And within that, I started to think about how Patricia Hill Collins's idea of the matrix of domination could influence those critical questions. So the matrix of domination is based on Black feminist theory. And so the existence of Afrofeminist thought suggests that there is always a choice and a power to act, no matter how bleak the situation may appear to be. Viewing the world as one in the making raises the issue of individual responsibility for bringing about change. It also shows that while individual empowerment is key, only collective action can effectively generate lasting social transformation of political and economic institutions. And so here we can see this kind of matrix of domination, right? Systems of oppression, in order for them to be disrupted, it requires change at the individual level, collective action from a community level, and then changes within the institutional level. And so this framework you're going to see over and over in this presentation as a guiding force. So with that, I took the prompts within the catalog and actually organized them into prompts that would really be directed towards individuals within global health, prompts that would be more directed towards communities, and prompts that are directed towards institutions. So these categories also mirror the structures within global health. And this brings us to the big idea. How might critical reflection support global health practitioners in reimagining our interventions? So now we're going to move into the preliminary work, kind of where I took this idea after my general exam. And with that, we're going to answer two questions. What are global health practitioners' initial perceptions of critical reflection using question prompts? And what can be applied from human-computer interactions designed for reflection scholarship to design an artifact that supports reflexivity for global health practitioners? So moving to the first question. This was really inspired rather accidentally, if you will, and that Nancy Putkammer was on my committee. She really liked the list of critical reflection questions and asked me to come share those during a weekly team meeting with the Digital Initiatives Group. This was an informal workshop with 11 colleagues, and I made a presentation similar to today's presentation so far. Then I shared this FigJam board, so using Figma, it's a collaborative space, and asked colleagues to think about our global health projects, review the 55 question prompts across the different categories, and react using these embedded FigJam stamps. And then there's also an opportunity to add new question prompts. And so you can see the reactions here. I tried to give some categories for what those reactions meant. And here's the board again, organized by individual prompts, community prompts, and institutional prompts. So here is the data. This is what it looked like at the end of this hour-long session. You can see some of the reactions across the different prompts. And then we provoked and discussed kind of what this research meant and what these questions meant. So some results. I'm going to keep these high level in the interest of time, but you can refer to the paper for a lot more details. But overall, there was enthusiasm for this project, and there's recognition that this was a unique approach in bringing critical reflection to the work that we do. There was a lot of diversity across the prompts that seemed to resonate with people. So about half of the cards had at least one reaction, but 37% of the cards had only one reaction, meaning that there were some cards that were more exciting to multiple practitioners, but there was still some cards that really only had that one reaction. And that could reflect, the time. It was not a very long time to review the prompts. But I also think that it shows the diversity of prompts is really important to really resonate with the different types of global health practitioners, their work, their projects. Participants also added prompts to every single category. So showing that there was excitement that the prompts sparked new ideas for questions. There were no negative reactions to any cards, likely related to social desirability bias. So not only were we colleagues, but I am a colleague. And so negatively reacting to this exercise might be frowned upon or embarrassing for folks. And then also coming out of that was that they recommended a website as the tool to use. So really building this into a website rather than another kind of design artifact, just given that it could reach more of our audience and our colleagues. So moving on, we'll look at a literature review, a scoping literature review for the question, what can be applied from HCI's Design for Reflection Scholarship? So the methods here is that I conducted a scoping literature review, which is different from a systematic review, and that I identified and mapped available evidence. I did this by searching the Association of Computing Machinery website. And this, for those who haven't heard of it, is basically the PubMed for human-centered design and engineering. And I searched there for design for reflection papers to catalog methods and practices for prompting reflection and to research into how technology can be designed to actually support this reflection. So really looking at the design features and the way that technology can support. And then I reviewed the citations of the key papers that I read for additional papers, a sort of snowball sample of the citations. So I want to highlight a few key findings. So the top papers that I read and really reflected on, and you'll see this in the designs in a minute, were Senger's Principles and Strategies for Reflective Design, Fleck and Fitzpatrick's Levels of Reflection, Moles and Company's Technology Supported Reflection, and Bent Veltson's Systematic Review. So looking at Senger's work, this is really early work, so back in 2005, and this was trying to develop the principles and strategy to support reflexive design. So meaning trying to come up with both principles and the strategies to support designers as they reflected on the technologies that they built. So again, this includes principles for including reflection into design practices, and it also shared strategies for how to design for reflection. Next, we go to Fleck and Fitzpatrick, and they proposed a taxonomy for reflection to explore the depth and complexity of reflection. So here they actually give levels of reflection from low series of reflection to high reflection. And they do this through giving different categories for reflection, moving again from low to high. So at the lowest level, this is just simply revisiting something that you've done, right? And describing what you did. And this can move all the way on to dialogical reflection or exploring the relationships between things, transformative change, where you revisit with the intent to do something differently, and critical reflection, where you consider wider implications, thinking about things like socioeconomic issues, historical issues, et cetera. Next, I was inspired by Moles's work, both in 2016 and then the follow-up in 2020, really looking at how technology could support reflection and giving critical advice for comparative effectiveness across different technologies. And then finally, Bent Veltson's systematic review of design technology for reflection gave a lot of comparisons and things to think about. So first, this literature looked across many different fields to review how technology can support reflection. So across arts and health and well-being, learning and education, and sustainability. Next, this literature or this systematic review compared and summarized methods for evaluating technologies and gave a really nice summary for both qualitative methods and quantitative methods. And then within the quantitative methods, the authors really recognized the need for more research, and they ended actually by highlighting their own work, a recent validated survey called the Technology Supported Reflection Inventory, which you'll see in a few slides. And then finally, they created a taxonomy of resources and design patterns across all the technologies that they evaluated, again, to give some guidance for designers. So instead of really summarizing those results in great detail, I actually want to apply the results to the artifact designed for this project, and that's called the Reimaginator. So what we'll do is we'll walk through the designs, and I'll pull both from the formative research stage with the Digi team, and then also looking at the literature to apply it to the design. I just want to recognize that this is a draft design. And so you'll see across these slides a lot of open questions, and these are questions that I'm posing to colleagues across both fields and anyone online who'd like to contribute to them. So here is the splash screen. So again, this is called the Reimaginator, and it has 4 different sections: the Imagine section, the Relate section, the Resources section, and then of course the About section that will highlight this as my dissertation research. So a first design guidance is that I use the language of Reimagine, and I really wanted to encourage an active practice rather than this one-time passive reflection. Secondly, building on Senger's work, this is really designed to be playful and inviting based on this highlight of ludic design. So this idea is that people are playful creatures, and it can be a mechanism for developing new values and goals, for learning new things, and for achieving new understanding. So this ludic design promotes engagement in exploration and production of meaning, providing for curiosity, et cetera. And so really trying to make this a playful and engaging site. So the question that I have here, an open question, is what other interaction design elements can contribute to playfulness? And so this is a pretty static website at this moment. And so really looking for more ideas for how to improve the design. So the second part of this, or actually the two parts of the Imagine section, is first that you can reflect using question prompts tailored to global health roles. And the second is you can contribute a prompt, and you can recognize that based on the feedback from the Digi team, where actually doing the reflection sparked ideas for new questions. So the website starts off when you're going to the reflection piece, is to think about a project in your past, present, or future. So it starts with a really simple idea. It applies Singer's design strategy #1 to provide for interpretive flexibility. So really thinking temporally about flexibility and not trying to focus on the future or just the past, and really giving the user any opportunity to think about any global health project. The second thing, and this is also related to temporal flexibility, was from Ben Veltson's review as well, recognizing that that is a critical element for designing for reflection. Next, just to recognize the questions will actually come from the prompt catalog that I shared earlier. And looking at that prompt catalog, I want to highlight one key feature that came from applying the literature. And that is, I took every single one of the prompts and I recategorized them based on Flex and Fitzpatrick's levels of reflection. So the idea here is that reflection can provoke, light or deeper reflection. And so really trying to think about how to organize those prompts. And so some open questions here, should these categories influence the order that prompts appear? So for example, should we start a user with a really easy question and then build it over time to get them used to reflection? Or if we have a limited amount of time, should we jump in and really pose critical reflection questions, transformative change questions? And so that's an open question that I have. Questions are also categorized using Collins's matrix of domination, where each level aligns with a role common to global health. And so again, this is building on the idea of individual, community, and institutional change. And each one of those aligns with these common kind of roles within global health. So individuals who work in global health, designers who define and develop interventions, implementers who deliver those interventions, researchers who evaluate and research interventions, communities who receive them, and funders or institutions who actually provide the funding or kind of manage them globally, or lead them, I should say, nationally as well. So that's the Imagine section. And so just to walk you through what this would look like as a user, you would first select a role. And from there, you would receive a prompt. And I liked the idea of like a magic 8-ball where this thing just kind of appears to excite you. So there's one prompt per time that you click. And then similar to the reactions within the Figma board, but simplified, you can react to those prompts. And so the first is this relates to my project, not useful for my project, or I don't understand the question. This also applies Singer's design strategies #2, so users can interact with and rotate through many question prompts. And #3, that providing dynamic feedback to the user. So questions change based on their feedback, and we can update the prompts based on their feedback. So some open questions for this section. Do we need to do better definitions of the review icons? So thumbs up, thumbs down, are those universal? Should I mirror like social media features? So just thinking about those more critically. And then should I also force users to actually use one of those rankings or one of those reactions in order to get the next question, or do we want to make it a lot more flexible? So moving on now, when a person selects that a prompt relates to their project, then a screen will pop up for them to prompt a reflection. So this is a pretty simple 4-question survey that says, how does the question relate to your project? Add a brief and anonymous answer. Will your answer support any changes to your work? And then asking them for both where their project is located and their nationality, sort of look at the kind of north to south dynamics. This applies Singer's strategies #2 and 5, so giving users license to participate and building technology as a probe. This also leverages the idea from Moles and company around the fact that it's important to create something while reflecting, not just review an idea. In other words, the active process of replying to a reflection question is really important to kind of dig to a deeper level of reflection. So creation, as they say, has potential to support reflection by supporting externalizing thoughts and feelings. Reflection can be supported further by requiring briefness or through an adaptive process of creation. I wanted to highlight too here that we're asking for anonymous answers, so we're not asking for email addresses or any identifying features minus country and someone's nationality. And this idea is to reduce social desirability bias. And my hope is that it will encourage radical reflection. So some open questions. How might Lytic design be incorporated to make this more playful? How might the question, will your answer support any changes to your work, be worded or leverage better evidence of reflection to action? And this will come up within my committee for a deeper kind of critique of these forms, but I welcome questions or ideas from those in the room and online. Next, we move into the contribute a prompt. This leverages the idea from Moles that it's important to briefly create something again while reflecting and not just review the idea. So the same idea before, but again, kind of applied to contributing something to the site. I want to acknowledge a major limitation of the current prompt library is that they come from academic literature mostly. There's like a few podcasts thrown in, a few videos that I've watched, but mostly it's from academia and mostly from human-centered design and some global health readings. And so within this contribute a prompt, my hope is that there can be more diversity in the prompts and more diversity in the sources over time, especially as this gets more exposed to global health practitioners. So next, looking at the relate category, this is where you can view other responses and reply to other responses. So here there'll be a response gallery where you can see the prompts displayed as cards. And then, oh, I forgot to mention in the response section for a user, they can actually add hashtags to it so that it can be tailored to a specific intervention, or maybe they want to add something so they can come back to the reflection later. So they can customize their response a little bit and give it some tags, but again, trying to not make it reveal any identities. So once you click on one of these questions, so if you're interested in whose voice is strongest, and noting that this is coming from an individual, because you can see the blue around it. So you can actually filter by the role. So the person who chose the role of designer, then the prompt is categorized as somebody who is a designer, responds to it. And then you on the relate tab can actually filter and only look at those prompts that are filled out by designers if you so desire. Once you click on it, it'll pop up the prompt, the hashtags, and then it'll show you the person's response, and it'll give you a space to leave a comment. And again, this applies Sanger's strategy number 3 to provide dynamic feedback to the users via peer reviews. This also applies conversation as a design resource. And it also applies comparison as a design resource. So with the idea that if you and a colleague both answer the same question, that you could actually look at and see and compare answers. And by colleague, I mean anyone within the global health space. It might not be your actual day-to-day colleague. The other idea is that there's a search tab. So you could search by words within these reviews. You could also search by hashtags so that you could pull up specific prompts as they might relate to, say, maternal health or HIV care. Next, kind of similar to the Reimagine tab, we kind of move on to the resources tab. And this is where you can view related resources that are related to global health or DE&I initiatives or decolonizing global health. And you can also contribute resources. So through the process of the last few months of preparing for this proposal, I've extended this library of prompts. There's so many more resources, including toolkits from partner organizations, et cetera. And so really wanting to share and showcase those in this gallery of relevant resources, and then allowing folks to add resources. So just questions about how to display the resources, should we categorize these by a particular role, or we could also stratify by different types of organizations. So really thinking about how to make it as usable as possible. So next steps for this website. A big next step is going to be updating the designs based on today's conversation and review of my proposal. And so again, really welcome feedback from anyone here on how to resolve some of the open questions. And I'll just highlight a few of those. Again, how do we make this more playful? How do I evaluate accessibility and making sure that this can be used across different places and across different needs? How do we add more prompts? And then I want to think about things like how do we order prompts by levels of reflection? Next, we'll build the website. And so I'll say thanks to my friend Ale, who's agreed to help build this thing for me. And then I'll move into some usability testing. So with using heuristic evaluation, cognitive walkthrough, system usability score. This idea is to just make sure that the website is used as I hope, and make sure it's easy to kind of click through so that it will be ready for the next stage. And that stage is the proposed research. So once we have a pretty static design artifact, the idea then is to kind of move into my research phase. The two questions that we're posing here is, what is the effectiveness of this site, the Reimaginator? Does this tool support practitioners to reflect? And to what extent might engaging with Reimaginator provoke global health practitioners to rethink and reimagine their interventions? So for the first, with the workshops, really looking at the variety of participants and recognizing that this is not only targeting folks from the global north, but also the global south, and recognizing that this can happen, or this should target people within high-income countries, within low and middle-income countries, and ideally teams who work across. So workshop participants, the idea is that I'll do 4 workshops with different groups of global health practitioners. Those participants should currently work at a global health organization, and you'll see some examples on the next slide. Aged 18 and older, and not currently working with me on any projects. So I want to recruit groups from specific organizations and to try to touch on the different layers of the different roles, and therefore the different layers of the matrix of domination. And so trying to target potential here's a list of potential organizations to invite to the workshop. And within the committee, I'd like to discuss like how to target different groups and get some feedback. But again, welcome that from folks here, or welcome ideas from folks here. So getting into the structure of the workshop, there's kind of 4 parts of it. Pre-workshop survey, then using the tool, a mid-workshop survey, and then a semi-structured group discussion. So the goal of the pre-workshop survey is to obtain demographics and details about the participants and to learn more about previous experiences with reflection in terms of their global health practice. Next, we'll use the Reimaginator, so really opening up the website, having them use the tool, trying to make it fairly free form just to see how they use it, what things resonate. And again, that can be based on the usability testing as well, and making sure that I can, if I need to, I can target specific elements of it. Then moving to the mid-workshop survey, so capturing key details about how the site is used, measure the extent to which the tool supports reflection, and measure whether a perspective transformation has occurred. So for the latter two, using 2 validated surveys that came from the literature review, the technology supported reflection inventory to measure the extent to which the tool itself, so the technology itself, supported reflection, and then the learning activity survey to look at the perspective transformation. So looking at the technology supported reflection inventory, again, this came from Ben Veltson and colleagues, and this was the tool that they highlighted at the end of their literature review. This question asks a lot of, this survey asks questions across a variety of topics, really looking at how this website actually provokes reflection, and it uses a Likert scale with 7 different points. The second is this learning activity survey, which again was brought up in the Bent Veltson literature review as a survey that's been used to look at reflection and the impact of technology on reflection. This was used by Ortiz and Harrell, and they used it to evaluate a self-reflection tool. The learning activity survey was originally designed for measuring the impacts of formal education, and it relies on this theoretical framework from Metzrow on the 10 steps of transformative learning. And again, it measures to what extent a perspective transformation has occurred. So in other words, my hope with this survey is that this can measure the change from reflection into action and trying to predict whether or not this might provoke additional changes within the practice. So here's some examples from that is, this experience of using the Reimaginator caused me to question the way I normally act. All the way down to when reflecting on my projects, I thought about acting in different ways from my usual beliefs or roles. So some open questions, and this is a hand wave to both my committee and Dr. Turns. So this is, what other fields should I tap into for measuring transformation of self-reflection? And I'll just note again that the HCI literature review and that systematic review from Bent Belson said that there's fairly limited surveys within our field, and so curious where else I can pull from. And then I'm also really curious and want to dig into how we can measure the durability of this transformation. And so thinking about, again, how does this integrate into practice? So with that latter question, this is a big piece of the semi-structured group discussions. That's how we'll round out the workshop session with participants. The idea is to gain feedback on the design, utility of the site, and discuss ways that reflection can actually get embedded into practice. So really trying to get deeper perspectives on what that might look like and how the design of the Reimaginator can be redesigned to support that. So moving on to the question 2, so to what extent might engaging with Reimaginator provoke global health practitioners to rethink and reimagine their intervention? And so this would be a follow-up survey or follow-up interview rather with the workshop participants a month to 2 months after the workshop itself to really look at how they might be continuing to use the Reimaginator. So again, this is hoping to look at the durability and the integration of Reimaginator and reflection in general into practice. And I want to follow up with participants to measure what extent this tool provokes ongoing changes. I'd also like to learn about whether this tool has been shared with colleagues or embedded into routine practice, and then gather more feedback on how to improve the tool. So looking at the last part of my proposal is examining the theory of change, right? So the idea of what I hope that this Reimaginator will do, and the theory of change or a logic model is very common in the global health field to predict or to prepare for how an intervention and the elements thereof can influence outcomes and practice. So the theory of change here, and this is a nice draft, but that the Reimaginator is a tool that will support individual reflection. It'll support community reactions to reflections. It collects a diverse set of question prompts, and it shares key resources. And the hope is that by individuals using this site, it relates to a variety of individual outcomes. And these are really drawn from Collins's work on the matrix of domination and some of the changes that can happen within individuals. So the first one is really recognizing situated knowledge. And this idea from Collins that individual consciousness, so raising awareness of the limitations of your knowledge, can actually lead to new knowledge and change. The second idea is that revolution begins with the self. So again, thinking about how to disrupt systems really begins with individuals reflecting. The next is exploring deeper complexities of our field. And so having individuals start reviewing the prompts and using prompts from different fields like critical technology and feminist theory might shine new light on the work that we're doing. In terms of community outcomes, the idea is that by individuals in practice and coming together in groups, this sparks more collective action, that there's more community engagement and leadership, and that this can lead to, again, challenges to the status quo. All of this kind of leads to the institutional outcomes where we hope for that systemic change, internal policy changes, strengthen organizations and institutions within LMIC, increase funding equity. In other words, shifting the power asymmetries within the field. And we can recognize that this, similar to the matrix of domination and what's proposed, is that these things interplay. It's not one leads to the other. These can happen at the same time, and the design of the Reimaginator tries to target all of those levels for that reason. So the goal is that for the field of global health, it gets reimagined, it's more equitable, it's more locally led, it leverages more indigenous wisdom, and we get to universal health coverage. And you can see this kind of reflecting the ideas that Dr. Say and Pai recognized in that opening quote around how we decolonize global health and where we are going to reimagine it. So one acknowledgement, which I say is kind of a joke, but I think it's really important, is that this idea that a website is necessary but insufficient for this overall goal, right? But I do think that the use of reflection can really provoke action. And I also think that tailoring reflection, again, to those layers within global health's matrix of domination offers a tailored tool for that reimagination. So very intentionally designed to try to disrupt the systems. So with that, I'm going to turn over to the public Q&A. So we have about 15 minutes for questions. And all questions are welcome, but I've posed a few for you all. So if you have perspectives, both from my global health colleagues and from my HCDE practitioners, I've posed some on the wall here for you to consider. So it's open for any questions, and I'll open up Zoom so we can look at those too.
Thank you so much, Beth. So we have plenty of time to ask questions, so this really is for the public. This is your opportunity to engage, question, learn more. Anybody online?
Please.
I'm curious with this idea of like decolonizing global health and how much effort and internal reflection goes into the process to do that, of how you grew up, how just like how do you decolonize that process too, of like getting people to engage, giving feedback. I'm just curious, how you thought about those things and like how that impacted these types of questions.
Yeah.
Yeah.
I think a lot of this really kind of comes from the recent movement within global health, really reflecting on George Floyd's murder, and kind of pulling that into practice of the last 3 years. Tons has been written about we need to decolonize, but there's very limited kind of reflection on how to do that. There's often calls for we need to reflect more, we need to think more, but there are very few tools that I've seen that actually guide that process. So I think for me, this idea really came from my own recognition that I want to critically reflect on my own practice, and then just kind of built from there over the course of my coursework and then general exams and beyond. We have 2 questions in the chat. Patricia.
Yes, thank you very much. Good afternoon. Excellent presentation, Beth. I really enjoyed your presentation. So my question for you is, where do you imagine government and ministries of health in terms of using the Reimaginator, and what kind of desired outcomes do you expect to see?
Thanks for that question. Yeah, ministries of health and governments are a critical piece to the work and often kind of forgotten in some ways because of the funding and the who owns the power, who has the money within global health. But I do see ministries of health as a critical institution. So these are across different countries, having practitioners within those countries actually use the Reimaginator to look at different elements of global health. So some Ministry of Health practitioners are more researchers, some are more policymakers. So again, there are questions that are able to guide across those different role types that folks in the ministry may hold. And then what kinds of outcomes? Again, this idea is disruption and shifting power. And so again, giving a tool to ministries of health to have them kind of re-examine partnerships, re-examine what kind of knowledge is going into the policies and practices and interventions that are being deployed, again, can offer a space for reimagining those. Thanks for the question, Patricia. Oh yeah, Sean.
I'll ask a follow-up question. So I'm curious, as you define this and as you envision this, whether you see this being kind of a lot of the questions about a project, is this relevant to your project? I'm curious, but we often see like transformative reflection as being about the individual, and I think some of your questions about durability get at the change in the individual. And so I'm curious if you have thoughts on how you might measure shifts in the thinking about the project versus shifts in preparedness for future projects, right? And that ties into this other kind of thing I was wondering about, which is are there particular stages in a project where you think teams should use this or individuals should use this? Or is it okay at any time? It's just that sometimes if you reflect too late, yeah, maybe that project's not going to shift, but you're more prepared for the next one. So maybe my question is kind of around like overall use case and what kinds of changes you would expect or hope to see at both the project and individual level and how much you're focused on each.
Yeah, thank you for that question. So kind of within, if I think about interventions and really similar to HCDE in terms of, what we're building for technology, there's like a design phase, an implementation phase, and evaluation phase classically. And so within the roles for the individual, I've tailored to those spaces, right? So there's questions for designers. So at the beginning of an intervention to kind of think about what you're doing, questions for intervention or for implementation. So for those who are actually bringing those interventions into practice and delivering them, and then for the evaluation and research. And so it's actually flexible to try to target those different times and place points of an intervention. And then in terms of shifting, it's a great question. And I think I'm curious to see what happens in the workshops, to be honest, to see how I can get more embedded into practice. But I do think there's a lot of pause points within global health and global health projects. So in terms of the design stage, you apply for funding, you really put it through critical review within your organization. So that could be a space. Often with implementation, there's like a Ministry of Health review or maybe a review by a funder. So again, another kind of pause point for reflection and maybe using the tool. And then for evaluation, really thinking about that start whenever it does start, how do you actually design a protocol to be more reflexive and really making sure you're looking at different perspectives, asking different questions, et cetera.
There's a question online. Oh, and there's a question.
Yeah, so maybe we'll, I think we'll do Michael and then Trisha, Meg, Jay. We have time?
Yeah, I was thinking, piggybacking on a couple questions ago about, you had mentioned that you're sharing this out with practitioners, and I'm wondering, this speaks to a little bit of the decolonization aspect, like how you're focusing on maybe bringing in underrepresented actual patients to give some kind of responses. Because I think the practitioner piece is kind of, they've gone through a certain particular type of training that is also like needs to be decolonized itself. So if reflection is just kind of reverberating back what they have experienced through that training. And yeah, I'd love to hear you talk about that. Also, I have this piece, lateral solidarity by Rafael Ravenous, talks about this kind of like more intimate kind of relationship between the practitioner and a patient, trying to do some of that translation work about what kind of what the practitioner is taught to bring to the table, but then also how that can be translated to their particular understandings about what their needs to them.
Excellent. Yeah, I'd love to see that. The hard part in global health with engaging patients is that there's often like many layers and many kind of protections for good reason. And so I'm sure Patricia's smiling, given our work in Jamaica, which has been delayed now for 6 months, trying to get ethical review so that we can actually engage participants to review a two-way texting intervention. And so for this proposal to kind of look at communities, I'm trying to get kind of communities that are patient representative organizations. And so trying to kind of target those organizations as representatives of patients rather than individual patients, if you will. But I do think I'm actually curious within those workshops if we'll need to add more of an individual level layer for patients, for those recipients of those interventions. But right now I'm really thinking of it as kind of a community level of communities who receive intervention. Thank you. Trisha?
Hi, Beth. Thanks for the presentation. Really excited to see the work. So one question I had is, you had mentioned social desirability bias and your intention to evaluate, I guess, the impact of the Reimaginator through your workshops and also through subsequent follow-up. So I am curious if within the 2 tools you identified and your other supportive methods, how might you reduce some of the social desirability bias and getting feedback on use? Just thinking about, going to a workshop and having people say they had a great experience the entire time. And so trying to unpack more so into the weeds of what could be improved.
Yeah, totally. I think the first piece for the workshop is that during, like, when the participants use the Reimaginator, I would like to not be present and like hovering over their shoulders, but to be present if they have questions or, need some guidance on how to use the tool. But I find the hovering thing to be very awkward. So that's kind of one area. And then I agree with you just in terms of trying to get candid feedback from participants, in terms of, the focus group discussions. And so, yeah, I think really reflecting on the questions that I ask, and making sure that, I'm not asking leading questions and really being open and soliciting and asking for critical feedback to improve the tool itself. And I found that kind of in workshops that I host, really saying over and over and over again, you're an expert in this field. I really desire, your input on things, and really trying to make it a comfortable space can help. Thanks. Meg?
Yeah, hey Beth, great presentation. I actually typed my response if someone else in the room wants to ask a question.
Thank you. I'll look in the chat.
And if not, I'm happy to ask it out loud.
I see Nina and Lee put questions in chat.
Oh, great. Okay, thank you. All right, let's pull one from the chat and then Jay. So the question from Nina is first here. I'm curious to know if you considered longitudinal methods like a diary study where global health practitioners would engage with Reimaginator over days, weeks, courses of a project to support reflection and see how it can provoke action over that time period and why they may or may not be useful for your research questions. Oh, that's a great question. I think the idea here is I want to try to do a workshop to introduce the tool and then sort of see naturally if it gets embedded into practice. And so I sort of wonder if a diary study forces that, because you're asking somebody over time to kind of use this thing and reflect on it and actually apply the tool. But yeah, that could be a curious thing to maybe do with some of the workshop participants so that they use the tool over time and can give that temporal feedback. But yeah, I'm sort of hoping that releasing it into the wild, if you will, tailoring the design can actually be incorporated into practice. And that would be from, people using it through the follow-up study, and then also really critiquing the design of it itself during the workshops to try to get at that longitudinal change. Jay, do you want to round us out?
Yeah, it's like, how would you hope that like practitioners in global health learn about and then also like share the tool amongst each other after it's been launched, right? Like it's one of the things that seems to be one of the parts of, once you launch this, you want people to know about it. It's like, how would you hope that would happen?
Yeah, great question. I think there's a few different forums and places that I'd like to showcase this with. So I think first, kind of putting it to academics within literature and sort of, taking some of the top global health journals and trying to share that this tool exists. I think actually, I just lost my train of thought. I think actually getting ideas from the different levels. So there's some organizations that already have like D&I groups, right? And so trying to think about and kind of work with those existing infrastructures and seeing again if we can kind of tailor the tool for those different groups. And then, yeah, I think disseminating at different conferences. And so there's some kind of big ones in terms of global health practitioners for implementation, digital health groups. And so just trying to get the tool out there more publicly that way. Thanks.
Okay, should we include the public portion of the exam?
There's more clapping.
I have one more slide, of course, which is just the thank you to everyone who attended and just say you're like the best type squad ever. So thanks for all the messages and cheering, and especially for those who are here today. And then for colleagues who are abroad. So there are many of you who are joining from Liberia and Malawi. I know it's very late there, so thank you for tuning in. And then, yeah, if you want to scan that, you can access the proposal, and I do truly welcome more comments, so please keep the feedback coming. Thank you.
So we will keep the Zoom open because Sarah will attend, but you might want to
Pause. Yeah, I'll stop this recording, and then I think I'll make a new one just so I can have a record of this, if that's all right.
Yeah, you're scanning.